World Health Organization has launched a malaria vaccination drive. The move is aimed at eradicating malaria in the country by the year 2030. According to the Ministry of Health, although the cases have reduced, malaria remains a primary cause of illness among children aged 5 years and below. Faith Weru has more.
The Ministry of Health has launched a malaria vaccination drive to children. The vaccine was rolled out on September 2019, Kenya being among the 3 selected African countries alongside Ghana and Malawi.
The world's first malaria vaccine to reduce child illness and deaths from malaria in sub-Saharan Africa and in other regions with moderate to high transmission is a historic moment in the fight against malaria.
Though the ministry said that the cases have reduced, they insisted that it is still a threat, especially to pregnant mothers and children under the age of 5.
Malaria is still a leading cause of loss of pregnancy. Loss of pregnancy early, miscarriages, stillbirths, low birth weights, premature deliveries. Malaria is a cause of that.
Speaking during the event, Health Acting Director General Dr. Patrick Amoth called for behavioral change in using the mosquito net and seeking medication when symptoms arise.
And promoting social and behavior change to reduce infection risks. Having the net is one thing, using it properly is a totally different ballgame. I also happen to come from that region and I've seen bed nets being used either as barriers in the kitchen gardens, or sometimes we use it for fishing.
The ministry said the 4 vaccine dose is free and will be administered to hospitals countrywide.
It is a 4-dose schedule. The first dose given at 6 months, which coincides with vitamin A administration. The second dose given at 7 months, where children come to the hospitals to be weighed on a monthly basis. Then the third dose is given at 9 months, which coincides with the first dose of measles rubella. And then the 4th dose is actually given at 2 years.
So far, 2.3 million doses have been administered in the 3 selected countries, a vaccination which has reduced the infection by 40%. However, 400,000 deaths are recorded worldwide, with African children more affected, recording over 260,000 cases annually. The ministry said in vaccinating 200 children, 1 life is saved. Faith Weru, TV 47.
Now, majority of the schools that neighbor the Laikipia